My name is Jenny. I'm on the team leading the challenge, and I'm joined today by Brian Wallace, who is the COVID-19 testing coordinator at the Seattle Fire Department. Today, we will learn more about Seattle Fire Department's role in COVID testing and what that looks like day to day. We'll also learn a little bit more about Brian's career path and the skills that he really leans on in his day-to-day work, and how that might have changed over the course of 2020 and 2021. So thank you for joining us, Brian.
Thank you for having me.
To kick us off, can you tell us a little bit more about your role, your title, and what that means day to day?
Yeah, so I am the acting captain COVID-19 testing and vaccination coordinator now for the city of Seattle for the fire department. And what that means day to day is that I manage the operations of 4 sites that we have here in the city of Seattle, where we do testing. On our busiest days, we test 6,500 people. And on the lighter, more normal days, as the period we've entered now, we test about 2,000 to 2,500 people per day across these 4 sites. So I'm responsible I help build and develop the sites one at a time. I staff them, and I'm responsible for their infection control procedures, for connecting people to the right departments in the city for maintaining the sites. And then I staff them, and each site has a site supervisor that reports to me so that we can keep them operating. In addition to that, the fire department just started running mobile teams to do mobile vaccination. We have we're the first EMS agency in the state that's become an official provider for COVID-19 vaccine. And so we are sending teams out every week to populations that are going to get missed by that large federal CVS Walgreens program. Mm-hmm. And so we're doing vaccinations in those homes where those people need it.
Got it. And what does that mean, or where does that mean?
Where?
Mm-hmm. For those mobile testing.
So the project that we're working on right now is in adult family homes, which are congregate living settings where you have between 5 and 6 residents usually, and a similar number of caretakers. And these are elderly, vulnerable people that are all living in the same house that have minimal ability to isolate or quarantine when they're infected. So these are the kinds of locations that COVID-19 takes a heavy toll on if it gets in. So it's important to have them be in the first wave of people that gets vaccinated.
Got it. And so before COVID, what did you do?
So I've been a firefighter and a paramedic. I've been a firefighter for 18 years. I've been a paramedic for the last 10. In just the 6 or 8 months before the pandemic, I was working as the department's EMS training coordinator, which is how I ended up in this role. Actually, I was the first member of the department to learn how to do a nasal swab so that I could train a team of people to go test ourselves, and eventually to test on mobile teams in these same adult family homes that we're now doing vaccines in. So EMS training coordinator is a position where you're responsible for managing the EMT certifications for the entire department. We have about 1,000 people, and building and staffing the trainings that we have to do to maintain those certifications for the state.
It sounds like it's managing a lot of moving pieces, and all of them critical.
It's very dynamic. There's, especially with what we're dealing with now with vaccine supply, the supplies are uncertain. Their arrival can be somewhat uncertain. Testing, it's uncertain how many people we're going to need to test, which makes it hard to figure out how much staff you need. Mm-hmm. So it is we have a pretty mature system built now, but it requires a lot of maintenance to keep it operating efficiently.
Yeah, the way you're talking about it, it really sounds like the skill to stay calm amidst uncertainty and amidst sort of a rapid pace is critical for your day to day.
Fortunately, that's what the fire department specializes in. We're used to taking decisive action with a limited amount of information. Mm-hmm. So in many ways, we're very well suited to handle this challenge.
Mm-hmm. I feel like for a lot of folks who live in Washington and maybe aren't directly connected to the COVID response, folks know to think about and ask about testing and vaccine, but aren't totally aware of how the different levers connect. So, in the world of public health officials and policymakers, why is Seattle Fire Department in the testing lead? Like, what positioned you to take up that role?
Well, in the beginning, when we started running mobile teams to do mobile testing, we were once again filling these gaps where public health and the existing healthcare infrastructure didn't have the resources necessary to go to all the places that needed testing. We were seeing outbreaks at these large long-term care facilities, skilled nursing facilities, as most of you know, is where the majority of the deaths and the debilitating disease that we've seen has taken place. I think something like 2/3 of all the deaths in the entire state and perhaps country have taken place in these settings. And so it was very critical to get a lot of personnel in there at a fast pace. And most of these other organizations like Public Health and the Kaiser and all of the local health jurisdictions and existing structures just didn't have enough people. They were all working very hard, and we realized that we could step in. We had the skills to do it. We had the PPE. We had the ability, and all of us have the mindset and the training that we want to help the public however we can. And once it became clear that this was a role that we could fill, it was easy to just kind of step into it. And then as that developed into trying to test the community in a larger scale, we had developed a very efficient model for doing testing. And so it was simple for us to scale that. And to be honest, I only thought we were consulting when this started. And I did not expect 6 months later for the fire department to really be leading the testing charge in the city of Seattle. Now, we're not doing that alone. There are a lot of departments that are involved to make that happen. But as far as the day-to-day operation goes, that has just become a new role for us.
Yeah, I guess it's not surprising that folks that would opt into a profession like firefighting would also feel the call to action, the call to respond and fill in needs to step up during a time like this.
That's absolutely right. I mean, for me, I think for a lot of us, the choice was clear. Like, we're not just going to hide under our PPE and wait for this to blow over. If there weren't enough people to get the work done that needed to be done, then of course we were going to do that. Mm-hmm. So that's the position that we also currently hold on administering vaccines. You know, in a normal time, we would, even though we have paramedics that routinely give people shots, that give people medications by IV, and EMTs are also trained to deliver IM epinephrine for people that are having severe allergic reactions. Delivering vaccines is obviously not something that EMTs have historically done. Mm-hmm. But the state was looking ahead when I think November had kind of come around and it was clear that we were going to have vaccine, and they knew that we would need this to be an all hands on deck operation where everyone who was able to administer a shot should be certified to do that. So they made an adjustment to our scope to allow us to do that skill in the field.
And so we talked about sort of calm under pressure and calm amidst uncertainty as key skills. What are some other skills, either technical or interpersonal or transferable, that you and your team use day to day?
We're all very used to going into a situation that's chaotic and stressful and scary for people and providing a measure of reassurance and calm, and knowing that whatever the problems are, we're going to work through them one by one, right? If that's a fire in your house, or if it's a business that's being flooded by an activated fire alarm, like, our job is to come in and manage the chaos. And I think we're pretty good at engaging with people on that level. We enjoy a lot of trust with the public, and we take that very seriously. And that skill of having people that arrive to get a test or get a vaccine that they're not sure how they feel about, and they're feeling a lot of anxiety, and they need someone to just look them in the eye, talk to them transparently about what's going to be involved, and coach them through that process. That's something that we do quite well. And we do all the time, every day when we go see people for medical emergencies. So I would say that's the main thing, beyond just the physical skill of handling medicines and now a vaccine. That certainly took some training, but we're used to medical equipment and we're used to keeping people calm. So
Yeah, and
those would be the main ones.
I feel like navigating chaos is something that most, if not all of Washington's youth has gotten a little taste of just by getting through 2020, right? Even if you're not in a
Yeah,
particular profession, navigating school, navigating other learning, navigating life outside of school has given you sort of a starting point of those skills.
yeah. I think everyone in this pandemic has been forced to learn new things, right? Learn new ways to cope, learn new ways to interact safely with one another, and yeah, we're all doing that too.
So as you know, a lot of the youth who are participating in the challenge are middle school age, high school age, or out of school youth, but in that like age band. And a lot of folks are sort of exploring interests. So not necessarily knowing I want to be this profession or in this industry, but that they particularly like a certain class or a certain club or a certain skill or activity is really exciting. So when you think back to when you were middle school or high school age, were there any classes or clubs or anything that gave you an inkling that you might end up in a profession like you're currently in?
Um, that's a great question. I think back then I was pretty uncertain that I knew what I wanted to do, but I knew I wanted to be involved in something that would let me feel like I was helping people. And back then, I would say most of my activities were more oriented towards volunteering with homeless teens or homeless adults here in Seattle. I helped run some youth shelters for a little while. And so there was an element of wanting to help kind of solve some of the problems in society. And that to me was an inkling. There were people that suggested, oh, maybe you would like to be a firefighter. You know, they don't just go fight fires. They actually are, in many cases, they're the kind of frontline healthcare service for a lot of people that don't have good access to healthcare. So that idea kind of germinated in me for about, it wasn't until I turned 29 that I became a firefighter. And so it had about 10 years to mature while I learned about the profession.
I think that uncertainty and your when you entered into the profession are really helpful reminders, because sometimes there's this narrative that like you should just know what your calling is or know exactly where you want to end up, and then it should be a direct line there. And it seems like that's actually, it's great for people who have it, but it's very common to be uncertain or to have an element of a career that you know you want, but the rest is uncertain in the beginning, and that you don't need to go straight from elementary school or higher ed into the profession that you will end up in. That sometimes it's a squiggly line, and sometimes it takes some time to marinate.
Yeah, you're absolutely right. I think there's a lot of pressure on people to figure things out quickly, to make all the right choices and go to the right school and have everything mapped out so that they're sitting in a dream career by the time they're in their early 20s. And I don't think that's realistic for a lot of people. I think as long as you keep yourself sort of moving forward, you're doing good in the world, you're exploring things that interest you and help you develop ways that you can contribute to society, none of that's bad, right? None of that is taking away from your life or a possible future career.
Mm-hmm. Yeah, and it seems like the sort of motivation that sort of eventually guided you towards your current role is that inkling to help, the urgency to help, and that could go in a bunch of different directions, but that it includes the direction that you ended up going in.
That's right. And I think I chose this because I was, frankly, I felt a little overwhelmed by the world when I was a little younger, and I despaired at all the different ways that there needed to be help in the world. And I was concerned about the environment. I was concerned about all kinds of inequity that we see in our society that leads to people living in a city of tents while other people have much too large, giant, beautiful homes. And at a certain point, I recognized that I could not solve all of those problems, but that it was up to me I could make a choice to pick something that had a scope that I could get my arms around, a way that I could help. You can't help everyone in the world, but you can. For me, choosing to be a firefighter meant I could choose to be a person that helped everyone near that fire station when I was on duty. And in this new role, I found the opportunity to be more useful, I think, than I was on a fire engine or on a medic unit.
Yeah, and you've taken us through like what your responsibilities include, but tell us about like a day in the life. What is a typical day? Well, maybe there isn't typical, but what does a day look like for you?
They're all different. They're all very hectic. Like I said, there are many people working around the clock right now to try to get vaccine into as many people as we can in the state of Washington, and into as many of the most vulnerable as we can first. And those are complicated goals to accomplish. And so a typical day for me involves a lot of meetings. I'm usually up by 5 or 5:30, doing a little work on my computer, joining meetings by about 7:30. I then rush to one of the sites. Right now, I'm training these mobile teams to head out. And so I do a training for new mobile team members every morning from about 8 to 9:15 when they leave. I usually try to go with them to at least their first job, for lack of a better word, and make sure that they really understand the process and that they're getting set up well. And then I go back and I do more meetings and I do more emails and I go to the sites and make sure everything is running well there. And so I realize I'm not making this sound very, very glamorous, but there is just so much coordination going on that when I say I'm doing meetings, it's at certain times of the day, it's with people that are just working at the sites. At other times, it's going to be with people that are in our finance and administrative services division with the city of Seattle to help coordinate logistics for the sites and kind of get all of our anticipated needs lined up so that we can be ready when more vaccine starts coming. And then, of course, I'm coordinating with other elements of city government with the mayor's office to figure out what are the sites that we're going to vaccinate? How do we make this the most fair? How do we help everyone understand that they need to be patient and their time is coming? And how do we message that? So my days are pretty busy right now. In particular, they're going from 5 or 6 in the morning until about 8 or 9 or 10 at night.
A lot.
It's not usually like that, but right now, and it's exciting, right? It's very busy right now, and it's obviously hard, but I'm so happy that we have this tool now, the vaccine, and that we have these problems. So that's good. That offers a glimmer of hope.
Yeah, and it seems like you're navigating a ton of pieces, but that the themes are that it's a lot of problem solving. It sounds like it's a lot of coordination and communication, and it's helping decision makers make informed decisions based on what you're seeing in the field, because you're doing a lot of connecting with people who are making those system decisions, and you're training and in the field at those mobile units. And that's a really high impact position to be in, to have both, to zoom in and zoom out like that.
Yeah, that's right.
So for the State of Innovation Challenge, 2 of our case questions revolve around COVID specifically. One is responding to COVID, and the other is life after COVID. And I feel like your day-to-day connects to both. For responding to COVID, students are thinking about things like, how do I wade through the ocean of information to understand what's true, to understand what sources to trust? And I think there's also a lot of reflection on the sort of analysis paralysis that you talked about earlier, of just like so much happening and wanting to help, but having a hard time wrangling that into, okay, what bite can I take out to actually do something? And that leads into the second case of life after COVID. How do we not go back to the same normal, but a better normal in terms of protecting our workers, in terms of sort of foundational public health and preventative health type things? So as I'm talking through these prompts and the types of things that students are thinking about, do you have any advice for someone who is living through this, but that probably doesn't have the visibility you have into these networks? What advice would you have for students as they're thinking about how to develop a response to those types of questions and problems?
It's a challenge. I feel as much work as this is, I feel very lucky that I am able to engage the problem on this level. I know that many people would like that opportunity, and I think it is a challenge for young people, especially, to appreciate that right now our options to really enact significant change are very limited, and mostly, and part of the problem we're having in this country is that we have to see all of our small decisions and choices and um, things that we do on a day-to-day basis as all contributing to this larger whole. So I think right now the thing that people can do, there's a baseline for what you can do to help the most, and that's not to spread the virus, right? To listen to the public health officials, to understand that it is serious, even if it's not having particularly intense in general, not always, but particularly intense consequences for young people, that we don't really get to reopen society until we no longer are overwhelming the hospitals, and until the oldest and most vulnerable among us are safe at any level. So people kind of need to have that baseline for what they can do to help. I don't really know what things are possible for young people right now. I'm curious about what kinds of projects people are coming up with and what they're interested in. I think finding creative ways to, it might not seem like a real solution to the problem, but the more people have creative ways to interact and hang out to kind of replace the in-person socializing that we used to do, the better. Any ways that you can find to share time and life with your friends and family that don't involve the risk of spreading the virus are huge. And so I think sharing that kind of thing, I don't know if it's making art that can be shared remotely, if it's music, or I used to be a visual artist. I don't have any time for that now, but I feel like, especially for those among our young population that are creative, now is the time to kind of dig and give people content and ideas, things they can share. I heard about Shanty Talk the other day on NPR. That might be a bit of a stretch. That's singing people doing sea shanties together on TikTok. And it's silly and it's absurd, but it's a way to find joy in this very isolating and lonely time.
Yeah. I think a little silliness, as long as it maintains like COVID safety, is welcome in this day and age. And it sounds like a big theme is that State of Innovation Challenge and other venues for problem solving are huge opportunities to come up with creative solutions, and maybe not the most obvious or not the most direct, but solutions that support building community and like helping life continue even in such an unusual time.
Yeah, I think we have to put some energy into those things to keep them alive. I really worry about this generation of young artists and not having a chance to share their skills and their talents with each other. And I think, I don't know, finding a way that we can pick those things back up again is critical for culture.
Yeah, well, and it's great to hear that the person in charge of like the most direct response of like testing and ultimately vaccine responses around Seattle is thinking about art as well, and is thinking about the value of art. It's a reminder that those dots really do connect.
I think we all want the same things. We all want to go back to. It's probably never going to look exactly like it did before, but we want to go share spaces and share stories. And I used to love going to the Moth and sharing stories and listening to stories and all kinds of live music and performance. Those are important parts of our culture, and they are suffering intensely right now. So I would like to see people finding ways to keep that alive for us.
Yeah, big challenge and also a big opportunity.
Mm-hmm.
Awesome. Well, I think that's a good sort of question and answer to wrap up on. Just to recap, we learned today about Seattle Fire Department's role in COVID testing and what it means to be a leader in that world. We've learned a little bit about Brian's career path, along with his advice on responding to some of the State of Innovation Challenge case prompts, and a little bit more about how the dots do connect across building community, across direct response to COVID through testing and through vaccination, and through the parts of our community that need a little extra support, like our world of artists. So Brian, thank you so much for joining us today.
You're very welcome. Thank you for taking the time to talk to me.
Of course. All right. Until next time, take care.
Thank you.
Bye.